right now, we are only providing vaccines to employees that are essential employees. But our UCI Health patients who are 65 and over, who qualify for getting the vaccinations now, the administration decided that it's best if we set up the center at UCI campus so that once the employees are able to get the vaccinations, we can continue to do so at the same center. So a team of people set out to identify the appropriate location suitable for this purpose. And it is now set up in the concourse of the Bren Event Center, which is the home for UCI Anteaters basketball teams. So we have taken up the entire concourse of the center, and the East concourse is set up with 18 registration tables, and the West concourse is also set up with 18 vaccination tables, with a 19th table for patients with special needs. There is an open terrace between the two concourses, and that we have set up as an observation area with a sitting capacity for 50 people, and of course, socially distanced. Every patient, after they're vaccinated, we need to keep them under observation for at least 15 minutes to make sure that they don't have any adverse reaction to the vaccine. We also have a separate area for pharmacists to prepare their doses. At this point, we have administered both Pfizer and Moderna vaccines, whatever is available to us, with a capacity of up to 2,300 vaccines a day. Vaccinations are given by appointments only. And so UCI Health has set up a portal for people to set up their appointments on their website. They said that we need to have the vaccination start on January 16th, giving us just 2 days to plan the entire operation. And everybody came together. We had a meeting. Everybody kind of were assigned the task, saying, okay, here are all the things we are going to need. And honestly speaking, within 2 days, we had the whole thing set up. So we vaccinated people on Saturday, Sunday, and Monday. To date, we have vaccinated about 15,000 people. We right now have a capacity, or we have built a capacity to vaccinate about 2,300 people on a daily basis. This is truly a team effort, with our emergency operations team taking the lead, and is supported by staff at the Bren Event Center, facilities management, transportation and distribution services, EH&S, procurement, police department, IT, and dining services for all the infrastructure and logistical needs. On the clinical side, we have our UCI Medical Center staff, Student Health Center staff, School of Pharmacy and School of Nursing providing volunteers, and HR helping with all the temporary staffing. So as you can see, this is the best example of teamwork and collaboration, with everyone on the team contributing and willing to help in every way possible. It is truly amazing to see how everyone has come together to make this operation successful. Wow, that list can be quite exhaustive. Let me just highlight some of the key factors that need to be considered. So whoever wants to set it up, they can plan for it ahead of time and not scramble like we did the last minute. First, you have to make sure that you consider the age of the patients and special needs for elderly people, because when we are vaccinating people who are 65 years of age and older, many of them have the needs for wheelchairs. We have to make sure that the areas on which these wheelchairs are going to be rolled are very free of any hazards, and we have to make sure that there are no trip hazards. We need to make sure that there is plenty of water available for them. We had to make sure that we had first aid kits at the location, even EpiPens. And we in fact have an ambulance that we have parked during the entire time we are vaccinating people, from morning till evening, in case there's an emergency. It's right there, and they can immediately take patients to the nearby hospitals. We, in fact, also had to put up some extra restrooms, porta potties on the outside, because the first day we did not think of that. We thought we have plenty of restrooms inside the building because it's after all, an athletics event center. It became very cumbersome to have people go inside the building and then have to have them come out and go back into their lines. The other things that we have to think of are the traffic patterns. These people are very anxious to get vaccinated. So they, even though their appointment may be at, let's say, 9 o'clock or 10 o'clock, they start coming in at 6 in the morning, 7 in the morning. I mean, nobody wants to lose their turn in getting vaccinated. We have to make sure that there are sufficient parking facilities. People come, like I said, well before their time. And so we have to make sure that there's good queuing arrangements. We had to put up a lot of signs to make sure people know where to go and, not try to just come in through anywhere in the middle. We have set up a lot of barriers. And of course, we need a lot of volunteers. On the inside of the building, there's a lot of needs for IT infrastructure. We have to set up computers on every table, both for registration and in vaccination area. And, so we need the IT folks to really help out. And they did a great job to work actually through the weekend to make it happen. Also, we need to have internet in the area. We need to make sure that the layout of the tables is done correctly and properly, because we have to make sure that there is room for the wheelchairs to go around. Make sure that there are no hazards when they have those cables running. So we have to think of the flow of how we are going to, have everybody navigate through the registration and vaccination tables. As I said, we need computers and iPad tablets, desk lamps for pharmacists so that they can make sure that there's enough light for them to pull the correct doses. Also, a large storage room to store all the clinical supplies, water bottles. We also had to have room for fridge and refrigerator and freezers that can be secured with locks. We had to make sure that there's security cameras so that we can keep an eye on it at all times. We had to have 24/7 monitoring of the refrigerators and the freezers that have the vaccines so that we can make sure that, the temperature is well maintained. We had to make sure that we had food and water for the staff and lots of water bottles for patients and their caretakers. Then, of course, there's the issue of all the clinical supplies that we need for the actual vaccination, wipes, sanitizers, and other cleaning supplies, janitorial services. Every time a patient sits and then leaves, we clean up the area and the chairs. We have to think of all the things for the inclemental weather, such as rain, heat, cold, etc. So we had tents, we have fans, we have floor mats, umbrellas, umbrella bags, heaters, propane tanks, and the ability to filter the propane tanks as they run out of propane. So a lot of planning needs to go into looking at all these factors. The first day we started vaccinating, it was a very hot day. And who expected it to be hot in January? We had to find ways to supply a lot of water to keep them hydrated. We had actually put up some tents in some areas, but we realized that may not be enough because we still had some open areas. And so we decided to have tents and canopies along the entire exposed pathway for the patients where they stand in line. Once we did that, the following week, we had heavy rains. We had to actually bring in a lot of extra staff and volunteers to actually mop all the puddles using squeegees to prevent hazardous conditions, along the whole path and where we had the holding area for observation. And then a week after that, interestingly enough, it got very cold. And so we had to bring in heaters to keep the patients warm while they were waiting. So it's like, you got to plan for all contingencies and all possible scenarios. The other interesting thing that many people try to sneak in line without appointments. We had to make sure that we had extra people who were observers to make sure people don't cut in line. The funny thing was many of the caretakers, when they would get to the vaccination tables, they would also kind of try to fake the fact that they also have appointments. And when they did not, and try to get vaccinated, and the nurses wouldn't know, okay, who has the appointment and who doesn't. We had to actually purchase quite a lot of wristbands of many different colors and patterns that we now, place on every patient's wrist when they check in, so that the nurses administering the vaccines know who is supposed to be vaccinated. We have to be agile and prepared to adjust when changing conditions and environment. Like I said, we kind of thought of many things, but as we went along, we found more things. And then, we always did a post-op, evaluation of what went well, what didn't go well, where can we improve. And so continuous improvement. We look for ways to make it continuously better, the entire operations. And so that has been one of the key things that we have learned. Working together as a team, I don't think there's anything that we cannot accomplish. And the can-do attitude of everyone on the team is just bound to bring success. Last thing I can say is that we really can feel proud of being a part of something that saves lives and brings us one step closer to bringing normalcy again.